Good day. I am Dr. Christine Latorre Mendoza, an active pediatric neurology consultant at the De La Salle Medical and Health Sciences Institute. For today, our topic is about lumbar puncture in infants and children. Our lecture is to properly perform lumbar puncture in an infant and to properly assist a resident in performing a lumbar puncture in an actual patient. The following are the content of this lecture. Lumbar puncture refers to a procedure that is important in the diagnosis of a sinus infection. It entails the collection of appropriate amount of cerebrospinal fluid to be sent for analysis. Lumbar puncture remains to be the gold standard procedure in the diagnosis of any sinus infection. The following are the indications in doing a lumbar puncture. It is usually done to determine the presence or absence of meningitis, encephalitis, subarachnoid hemorrhage, intracranial hypertension, leptomeningeal carcinomatosis, pediatric neurotransmitter diseases, and neurodegenerative disorders. However, as in any other procedure, there are contraindications, and that includes the presence of infection over a spinal canal in the lumbar region, increased bleeding tendency, focal intracranial mass lesions, and increased intracranial pressure. The following are the materials needed to be prepared in doing lumbar puncture. We need 5 sterile vials, which are numbered with caps, sterile gloves of 3 sets, povidone iodine and antiseptic solutions, sterile gauze 2 pieces, sterile ice sheet, sterile needle of gauge 20 to gauge 25, a manometer, a 3-way stopcock, and a lidocaine without epinephrine. The following are the steps needed to perform the lumbar puncture. We need to obtain an informed consent before the procedure. Then, we need to place the patient on NPO for a maximum of 2 hours, but should not be allowed to be placed in a starving condition. We need to perform fundoscopy and obtain a random blood sugar. We also need to place a patient on NPO for a maximum of 2 hours, but should not be allowed to be placed in a starving condition. Next, we place the patient on a left lateral decubitus position and identify the landmarks before cleaning and having the area for puncture sites. We need to also prepare and insert a gauge 25 sterile needle and wait for the pop feeling, and a clear liquid would come out of the needle at the end. Also, we need to attach a 3-way stopcock and a manometer to measure the CSF pressure, followed by carefully collecting the CSF, which is freely flowing into the sterile vials, approximately 10 drops per vial. After this, we gently rotate the needle clockwise, then remove the needle, and apply pressure on the site where the sterile gauze to cover the puncture site. We need to send the specimen labeled for analysis, and we need to properly label them to determine the cell count, the culture and sensitivity, gram staining, total protein and sugar determination, and we can save specimen for TB-PCR, viral studies, or other needed CSF studies as deemed necessary. The following is the illustration that we do in lumbar puncture. Okay. The spinal fluid is usually collected for testing. In children, we insert the needle at the level of L2 and L3, okay, while the patient is placed on the left lateral decubitus position, most of the time in the left lateral decubitus position. Otherwise, some patients, depending on their dexterity, they may use the right lateral decubitus position. Other patients may be allowed to be in a sitting position as they do perform lumbar puncture. After we collected the CSF and determined the results, we also have to determine the normal values for us to contrast and compare the results and determine for the proper diagnosis. The normal CSF values includes the opening pressure at 60 to 80 manometers mercury. It is usually clear and odorless with a WBC of 0 to 5 cells per cubic millimeter, predominantly lymphocytes. The CSF glucose lies between 2.5 to 4.4 millimoles per liter. And the CSF protein concentration in children, depending on the age, varies. Up to 6 days of age from birth, they may have as high as 70 milligrams per deciliter. From 6 days to 4 years of age, 24 milligrams per deciliter. And if children more than 5 years of age, they may have 15 to 45 milligrams per deciliter. Now, the following are the different CSF values on different conditions. We have tabulated here the most important conditions wherein we see in our practice. We may see bacterial, viral, fungal, or TB infections affecting the CSF. And the following are the common normal values that we see to help us determine which among the different pathogens would help us make a clear diagnosis with regards to children affected by meningitis or encephalitis. As in any other procedure, we need to do monitoring after we have done the procedure. Post lumbar puncture orders as doctors would include for our patient to remain flat on bed for 4 hours, maintain on NPO until fully awake. We have to remove or change the back cover if soiled, especially in children, to prevent infections on the LP site, and do neurovital signs every 2 hours until stable. Now, the following are the possible complications, but may happen only as in less than 1 to maximum of 2%. This may include headache, iatrogenic infection, bleeding, back pain at the puncture site, and herniation. Thank you.